Thank you for becoming a preceptor for the Memphis Fire Department Paramedic Education Program. The purpose of this orientation is to familiarize yourself with the role of the preceptor, clinical training, how to provide effective feedback, and how to evaluate students. Remember that you weren't always successful. Many new paramedics look at successful pre-hospital care providers and think they were always that way. Most professionals have had great mentors and were developed over time and through much trial and error. We've received correction along the way. You are now the mentor. You are now a preceptor and thus a mentor. Many times you are the first medical professional that the student will see in action, and your attitudes and actions have an impact on the kind of paramedic student they will eventually become. The mentoring the student receives is just as important, or maybe more so, as the training he or she receives in the classroom. Students need help managing anxiety. They need to develop a professional identity, and they need to understand that there are a variety of strategies that are effective. There is not just one way. They need to develop their own style. It is your responsibility as a preceptor to provide a model the student can emulate, to transmit knowledge of problem calls, to help the student manage anxiety, to supervise and guide field performance, and to provide a positive and correctional feedback that will allow the student to grow. Complete and honest filling and signing of the student evaluation forms is a must. Preceptor characteristics we look for are good communication skills, establishing a climate that is conducive to learning, sharing practical steps in patient care, providing positive and correctional feedback when necessary, listening to the student, and being knowledgeable in medicine. Your role as an EMS preceptor is to guide our students and provide helpful knowledge when needed. You must be able to sit back and let the student care for the patient while preventing the student from doing any harm to the patient or themselves. You must make mental notes about the good and bad aspects of care and review with the student these aspects in a private setting. Preceptors should keep an open mind that there are more than one way to reach a certain goal. You should allow the student to experiment with their style that remains within the confines of safety and respect. Remember that the students are still in the learning process. They should not be expected to perform to the level of an experienced paramedic. If the student has a different style than your own, you should ask yourself several questions in the evaluation. Is it safe? Does it meet the standard of care? Would the medical director approve of the style? Does it cause any harm? And is it offensive in any way? Our students go through several phases of clinical education. The beginning phase is where the student may be book smart but lacks experience. The primary focus during this phase is for the student to practice newly learned skills and become competent with them. They may answer questions and you may quiz them. However, you have to remain available to the student. Phase 2 of clinical training begins when the student has some experience in their role as an EMS provider. EMS students should start to integrate as members of the medical team. These EMS students should be allowed to start taking an active role with non-complicated ALS and BLS calls, for example, chest pain or a single system trauma call. You must be there to oversee the care as their team leader. You must remember that the real learning begins here in the field. Under the supervision of the paramedic preceptor, the student should be encouraged to take a more global view of their role by paying attention to such details as delegation of assignments, transportation priority and needs, reassessment of the patient, and providing care accordingly. The final phase of our students' clinical education is the team leader phase. He or she should take charge of most ALS calls up to their scope of practice, including cardiac arrests and multi-system trauma calls. They should by this point show competency and comfort with their role up to their scope of practice. At the beginning of each shift, you should review with the student how much field and clinical experience they have completed and what phase of clinical experience they are currently in. Find out the student's perception of their own strengths and weaknesses. Find out any issues and concerns that the student may have and try to discuss and focus on these areas of improvement. Relay your expectations of the student. Make sure that the student understands what is expected of him or her. Tour service areas and receiving hospitals or departments if possible. Review daily routines and responsibilities, and also review equipment and equipment checks. If a problem arises, the lines of communication begin at the level of the student and preceptor. If an issue cannot be resolved, there is information behind me on the appropriate person to contact. When providing feedback, there are several types of feedback. There is positive or correctional, and there is also positive reinforcement. We have tips for less stressful feedback and post-incident feedback. When providing positive or correctional feedback, remember that it is always given in a positive manner. Identify specific and measurable areas of performance that require improvement or an area that the student must change their behavior. For example, remind a student of the importance of auscultating lung sounds after the placement of an airway adjunct, or remind them to use end-tidal CO2 monitoring on a endotracheal tube or blind airway insertion device. Encourage desired behavior. Help the student build self-confidence. For example, praise them on their calm and confident behavior and illustrate how it helped relax the patient. State, you did a very good job. Qualities of feedback. The qualities we are looking for is that it is provided in a specific and timely manner. Feedback should be provided as soon as possible after performance. Remember that correctional feedback is always done in private, whereas positive reinforcement can be done in private or in the front of others, depending on the personality of the student receiving the reinforcement. We look for direct feedback as a quality. Always give direct feedback to the person whom it was intended. Only discuss correctional feedback with those individuals that are directly concerned. Your objective is to provide feedback that is conducted without any bias to race, gender, ethnic origin, sexual preference, or creed. Be clear with your feedback. Does the student understand what you as the preceptor said or meant to say? Remember that the feedback should not be general for goals of improvement, but pinpoint actions that the student can take to improve specific patient care. Remember that when providing correctional feedback, it can be unpleasant, but it must not be avoided. It needs to be timely and specific. Vague feedback doesn't give the student any idea of how to realistically improve their performance. When providing correctional feedback, ask the student what he or she thinks went well or wrong with the call. Talk about the positive aspects and provide reinforcement for things that the student did correctly. Identify the weak areas of the call and provide correctional feedback for these areas. End the run or patient review with a summary of the positive aspects and tips for student improvement. Most people are more receptive to constructive criticism if positive feedback was provided first. As a preceptor, I look for students with the ability to communicate clearly with patients. They must have the ability to manage the scene efficiently and the ability to complete a thorough patient assessment. While evaluating the EMS student during patient assessment, we are looking for the student to complete their assessment before we intervene to ask questions that the student failed to cover. However, do not let the student do any harm. Take mental notes about what they did right and how they could improve their assessments. When evaluating our EMS student for skills performance, be positive but honest. Remember that the patient is an audience to the process. Note weaknesses and skill competencies. However, do not let the student do any harm to the patient. When evaluating an EMS student for report writing, make sure that the chief complaint, patient history, assessment, and treatment outcomes are properly documented. Documentation of pertinent positives and negatives is key to developing critical thinking skills. Documentation of any variances or unusual aspects of the run will also help to reinforce learning. Now let's look at the forms the student will be using when they report to clinicals. Remember that as a preceptor, you should never sign a blank form. The student should have the form filled out completely prior to your signature.
This form is the clinical shift summary. The information on this form is an accurate and honest summary of the patients encountered and the associated treatments performed during the clinical shift. Assessment and procedures are documented in greater detail on the clinical patient care report submitted by the student. This form should have the incident number listed if used to document an ambulance patient. It should have the room or chart number listed if used to document a hospital patient. Both the student and the preceptor must sign this form. This is the patient contact report. It should include the incident number, a hospital room or chart number. It must be completed fully with procedure times and no spaces left blank. A complete narrative describing the scene size-up and the procedures performed must be documented under the remarks section on the second page. This form must be signed by the student and the preceptor. We encourage the preceptor to go over the student's narrative with them and coach them when they see deficiencies. This form is the affective evaluation of the student form. This is where the student is graded on his or her intrinsic qualities and how they use these qualities to relate to others. Be honest with this evaluation. When marking developing or not yet competent, please describe specific, measurable instances and corrective actions taken. This is used by instructors to guide teaching strategies tailored to the student's specific needs and provides a template for focused learning prescriptions. Please sign the form and then place it in the sealed envelope provided, signing the outside of the envelope. This is the evaluation of the preceptor form. This is the student's opportunity to evaluate the preceptor. It must be signed by the student and included in the paperwork of each clinical shift.
And remember, our students should show up ready to work. They should show up promptly before each shift with all their equipment at the ready. Here are some examples of how students should look and the proper equipment they should maintain with them. Our students should show up ready in their student uniforms. At no time are they allowed to wear fire department paraphernalia or uniforms, which may confuse their role as a provider. Also remember that our students are assigned one student per ambulance unit. We may have multiple practitioners in the hospital setting. However, if there is a conflict and there are too many students at that clinical site, please contact the clinical coordinator for further instruction. Thank you. It is dedication of preceptors like yourself that allow us to educate and train quality pre-hospital medical providers.